Hello everyone. Today, we're delving into the world of a medication called cyclobenzaprine, commonly known by its brand name, Flexeril, as well as its generic name. As with all our discussions, this is meant for educational purposes only. If you have health-related questions or concerns, always reach out to a medical professional. Description: Cyclobenzaprine, recognized both by its brand name Flexeril and its generic name, is a prescription medication primarily used as a muscle relaxant. This medication falls under the class of drugs known as skeletal muscle relaxants and is commonly prescribed to relieve muscle spasms and discomfort associated with acute musculoskeletal conditions. It works by acting on the central nervous system to help relax tense muscles. Cyclobenzaprine is often prescribed for short-term use, typically for 2 to 3 weeks, as an adjunct to rest and physical therapy to facilitate the recovery process from muscle injuries or painful conditions. It's important to note that this medication is not a painkiller but rather a muscle relaxant that helps alleviate the muscle-related symptoms. Warnings: Before taking cyclobenzaprine, it's important to be aware of some precautions. This medication should not be used by individuals who have recently experienced a heart attack, have certain heart rhythm disorders, or have a history of heart problems. It's also not recommended for those who have an overactive thyroid, glaucoma, or urinary retention issues. Before starting this medication, inform your healthcare provider about any allergies you may have, as well as your medical history, especially if you have liver problems, kidney disease, heart disease, high blood pressure, seizures, or a history of substance abuse. Cyclobenzaprine may cause dizziness or drowsiness, so it's advisable to avoid activities that require mental alertness, such as driving or operating heavy machinery, until you understand how the medication affects you. Avoid alcohol consumption, as it can intensify these side effects and potentially lead to dangerous situations. Side effects: Like all medications, cyclobenzaprine may have side effects. Common side effects include drowsiness, dizziness, dry mouth, and blurred vision. It's essential to be cautious when performing tasks that require concentration or coordination, especially when you first start taking the medication. If these side effects persist or worsen, contact your healthcare provider. Less common but more severe side effects can include fast or irregular heartbeat, confusion, hallucinations, severe dizziness or fainting, difficulty urinating, muscle twitching, or signs of an allergic reaction such as rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any of these serious side effects, seek medical attention immediately. Interactions: Cyclobenzaprine may interact with other medications, including certain antidepressants, such as monoamine oxidase inhibitors, MAOIs, and selective serotonin reuptake inhibitors, SSRIs. Additionally, it may interact with other muscle relaxants, sedatives, or medications that affect the central nervous system. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: The correct dosage of cyclobenzaprine is crucial for its effectiveness and safety. Always follow your doctor's recommendations. The typical recommended dose for adults is 5 mg to 10 mg 3 times daily. The maximum recommended duration of use is 2 to 3 weeks. Your doctor may adjust the dosage based on your response and specific medical condition. Avoid: While taking cyclobenzaprine, it's important to avoid alcohol, as it can enhance the medication's sedative effects. Also, avoid activities that require mental alertness until you understand how the medication affects you. Be cautious when rising from sitting or lying positions, as dizziness may occur, especially when starting the medication. FAQ: Many individuals wonder about the age restrictions for cyclobenzaprine. It is typically not recommended for use in children and is intended for adults only. Always consult with your healthcare provider for any specific questions related to this medication. Closing: That concludes our overview of cyclobenzaprine, known as Flexeril. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.